You were quoted in the New York Times this morning. You can tell us whether it's accurate, that one of the main reasons you stepped down was it would be awfully difficult to run without having to address some of the conduct of the president, reflected most recently in that interview on Sunday night from Ms. Stormy Daniels. Is that accurate? And do other Republicans share your view?
Well, I would layer some additional context on top of that. The state Supreme Court had changed 50% of my district a week before I had to circulate petitions, making it 9% more Democratic. Obviously, the lifestyle of serving in Congress is very challenging, particularly in a competitive district with a very young family. But there is an element to it that relates to feeling that no matter how well you think you're doing the job, that if the president says or does something that is off color, your constituents want to hold you accountable for that, or somehow suggest that you need to speak out more forcefully than you might already be doing. And the moment that you do that, you certainly run into the sawmill of the most strident pro-Trump voters in your district. So you do get squeezed on both sides, for sure.
So how many of your colleagues who are stepping down, because it is a remarkable list of people, Republicans who are stepping down, how many of them share your concern that essentially the first question you get asked at every rally is, but what do you think about this from the president?
Oftentimes, it's the second, third, and fourth question, and even after you answer it, 30 minutes later, after getting a few substantive questions, and I did my fair share of town halls, they would come back and say, yes, but what about what he said, and why are you not saying it what you really think? And that can be very, very frustrating, because the job is to vote and advocate on behalf of your constituency, not turn yourself into a soap opera commentator, right? I mean, but I think that some of my colleagues feel that way. I don't want to put a number on it or name names, because we're all trying to do the best that we can here. I don't mean that to sound self-serving, but there is frustration that there are times when you feel your job is just to respond to what the president tweeted or said or did. And that's not what the job is on a day-to-day basis, or it shouldn't be, at least. But many voters feel that that's what the job, they expect that to be your job.
Do you expect more congressional Republicans not to seek re-election? And if so, will the GOP manage to retain the House?
I think Republicans are well positioned to maintain control of the House. It's a very challenging political environment, but this is going to be a race-by-race contest across the country, and members such as myself that are in competitive districts know what it takes to win elections. In my particular case, though, again, a week before I was to circulate petitions, the state Supreme Court changed my district by 50% and took it from a district that Hillary Clinton won by 1 to a district that she won by 10. Never before in the history of this country has a state Supreme Court done that in the middle of a 10-year congressional redistricting cycle. But it will be a challenging environment, to be sure. And it will be, I think, a lot of these races are going to be toss-up races going into Election Day.
So, Congressman, let's try not to do what happens to in your rallies every time, which is only talk about President Trump's conduct. Let's talk about the merits, as it were. You're very concerned with affordable health care. What are you trying to do, and is it doable, not necessarily in this Congress, but down the road?
The cost-sharing reductions and creating reinsurance pools at the state level so that your state health insurance commissioners can administer health insurance plans in a way that would enable us to reduce health care costs is absolutely essential. The broader health care reform discussion, which we did not sign into law, is going to have to wait for another day. But if you look at where the healthcare costs are in this country, about 5% of the population incurs about 55 to 60% of the costs. So designing health insurance plans and creating reinsurance models that enable us to put them in the type of preventative care and the type of coverages that can, I hate to say the word, but segregate them so that you can get lower health care insurance costs for the rest of the population, but design health insurance packages that help the most acute, high-cost consumers. That's the appropriate way to go about doing this. And if we have 2 years to do that with the bill that I've proposed, along with Senator Collins and Alexander in the Senate, that's the first step to create that pilot program for a period of 2 years to come up with the data so that we can move this in the right direction. There are a lot of people that don't feel that the Affordable Care Act got it all right, but we also think that some of the patient protections that were embedded in the law should stay. And so I think that we have to look at this, we have to depoliticize it as best we can and try and move forward in a bipartisan way.
And when you talk about the preventative care for that 5% of the population you identify, is that largely Medicaid as a practical matter? And wouldn't that require more money, at least in the short run?
I'm actually talking about those that have rare diseases or those that have diabetes, those that might have a physical disability that requires more in the way of healthcare costs. And if you can broaden the access, because if you do have a rare disease or you're a high cost patient, sometimes just getting coverage and access in your region to the types of medical professionals that are there to serve you becomes very difficult, and that often requires you to travel long distances or to go have someone else look at you before you can go see the person that you really need to see. Those are the kind of things that I'm talking about from an access perspective, because when you restrict access, you invariably drive up cost.
So practically speaking, you were unsuccessful in pushing that Obamacare stabilization measure into the last spending bill. So when will be the next chance to get something done?
It's an excellent question. We're looking for that right now. Some leaders in the Senate, in particular, are trying to find the right vehicle to send it over to the House. I and some others will be looking for the right vehicle in the House to include it. We've run into a problem, and this relates to the Hyde Amendment, where Democrats at this point in time are unwilling to support CSR dollars and reinsurance dollars unless they can be used to provide fund policies that also provide for abortion coverage. That is not acceptable to almost all Republicans in Congress, and so that was a surprise. We didn't expect that the Democrats were going to object to the Hyde Amendment, because we've always attached Hyde Amendment protections to any taxpayer dollars that are appropriated by Congress. So that ideological battle, which I didn't foresee, and I hope that we can navigate that in a way that will enable us to move forward with reinsurance and CSRs. That's actually the major stumbling block, more than it is finding the next legislative bill to attach it to. If we can solve that problem, there are any number of legislative bills in the next several months that we could attach it to. But it does have to happen in the next several months. Right. Because state insurance insurance companies need to design their plans, get them approved by state insurance commissioners, get HHS to approve it so that these policies can be offered to employers by the fall. Mm-hmm.